All right, so we are live with our webinar here tonight. Got some registrants pouring in here. Just want to welcome everybody tonight. Hosting a webinar with myself, Giacomo Fabrizio from Nobleton Physiotherapy, Bradford Sports Medicine, newly minted, and Aurora Sports Medicine professionals. And I want to welcome you, everyone here with Justin Chan. So Justin, I'll let you say hi, and we'll wait till everybody gets in here, and we'll get started.
Great, thanks, thanks, Jack. So let me know when everyone's here.
Yep.
Give it a few more minutes so people can get ready, since not really absolutely the time yet. So before we get started, for people who are in here, just let you guys know, if you have any questions during this presentation, the chat is open for you guys. Make sure to address your questions there, or you guys can type in phone, PHONE, if you guys want to set up a more personal appointment, quick talk with me afterwards. We'll get back to you with an email to set that up as well. So
Perfect.
yeah.
We haven't done a webinar. We haven't done a webinar in a while, actually. I think Mike did the last webinar, so we're really excited. This is the very first webinar that we are hosting. Justin is hosting, and we've done one on chiropody, which we've traditionally done them in physiotherapy, sports medicine, that sort of thing. But we are now doing one with a real live chiropodist. We're really happy to have Justin join our team. For those of you, there's a few of you attendees still pouring in here. Tracy is was with us for almost a decade. I can't believe she was with us for so long. And Tracy Oliver, who is our original chiropodist, is retiring, and so it was a great transition. Tracy has going to move out to the East Coast in the new year, so it was a great transition to have Justin join us as our chiropodist for all three clinics. That's the other thing; he's going to be at all three clinics. So when all said and done, if you have any questions, you want to email Justin, you want to call him, you want to type into the chat, as Justin said, just type in phone chat, and Justin will be happy to pick up the phone and talk to you about anything before you actually even book in an appointment. So he won't send you a bill. He'll just call you and chat with you, because maybe you've done everything you need to do, and he can't help you. But I find that unlikely. If there's something that he can help you with, he'll let you know. So we're going to wait a couple more minutes. It's just past 7 o'clock. It is dinner hour, and we have about almost 30 people streaming in here, and I will just wait a few more minutes before we actually get started. So, Justin, anything you want to say before we get started?
Not really. Just warm welcome to everyone. Well, we haven't met most of you before, but it's a lovely opportunity for me to have this chance to share here a lot more about foot health in general, because a lot of you guys probably know foot health is one of the more neglected fields in the healthcare. A lot of people can hide it under a shoe or something, and not until it's more severe than they seek help. So it's great to hear about how important the feet is, as everyone take their steps every day, walk, and not realizing that how important your feet are until pain starts to be debilitating. So it's a good opportunity for me here to share the information with you guys, and hopefully learn a few things or two, so you can take home and have more knowledge about how to take care of your feet, or even have a greater understanding of what I do and what this profession is. And who knows, even furthermore, maybe you guys or some of your the younger generations out there might say, hey, you know what, chiropody is actually a really great field. I can tell my son or daughter, my grandchildren about this. Maybe they can become a chiropodist in the future as well. As a lot of people might not even heard about this profession. So yeah, it's a great opportunity for me to hear to share with you guys.
All right. So I'm going to we're going to start the presentation here. So so Justin, whenever you are ready, you can launch there. So
Okay, let's get right into it. So Jack here. You're able to see my screen.
I can. All right. If there's any technical glitches, please put them in the chat, everyone. I'd appreciate it so that we're not. I am of all people, I am the poorest of the clinicians within our organization with technology. So I'm hoping everybody can see the screen right now. But if you can't, please type it in the chat.
Yeah, feedbacks would be nice, even in the chat box. Doesn't always have to be questions. I'll take compliments as well. So
Yeah.
there you go.
All right.
All
So
right.
I'll hand it over to you, Justin.
All right. Thank you, Jack. So this is my first webinar, and welcome everyone who attend tonight with me. Tonight we'll be going through the basics, basically the importance of foot care. I'm your host today. My name is Justin. I'm a foot specialist, also known as a chiropodist here in Ontario. Before we get started, again, I just want you guys to know, on the chat here, any questions throughout the whole presentation, just type it in. We'll make sure to get back to you as soon as possible, maybe throughout the presentation, or if not, we can try to email you and set up a phone call or address your questions in other means as well. Okay, so let's get started here. So a little bit about myself first. I am a registered chiropodist, also known as a foot specialist. So I'm licensed with the College of Chiropodists of Ontario. So yes, we are regulated here in Ontario as a profession. I have a kinesiology background. I studied at the University of Toronto before I went into Michener Institute, which is a specialized medical college for my profession here in chiropody. And I love to do a lot of sports. I pretty much go to the gym every day. I try to go in the morning before I start my day of work. It gives me more productivity. Feels great to start the morning off that way. Also, I'm a sneakerhead. Very relevant here, right? As a foot specialist, owning sneakers, I like to collect sneakers and try them out. It's also given me a good opportunity to see, what shoes are good and not. So that's pretty good. And no, trust me, I don't have a foot fetish. You'll be surprised how many people ask me this question. That's probably it's a joke, but yeah. So it's like, what got you into this? Is a foot fetish. You guys might want to talk to me about. I got a long story to tell you if you want to, talk about it. But that's another question on its own. But no, trust me, I don't have a foot fetish. Okay.
All right, so before we go into the slide here, we're just going to throw a poll out there to everybody. So I'm gonna launch our poll, and if you guys just want to go ahead and answer the poll and let me know. So basically, it's who's been to a chiropodist before? Okay, so it's pretty close. It's almost oh wow. So we're looking at almost 50-50 here. I personally have never actually I have seen Tracy before, so I can say that I've seen a chiropodist before. Wow, that's almost it's interesting. We'll close the poll here and 26 of 26 answered. Okay, good. All right. So it is almost a dead heat, 54-46. So that's interesting. So I hope that for the 50% of you who have not been to see a chiropodist, that Justin will be able to enlighten you with some information. So I'll go ahead and close that poll. So back to you, Justin, with the presentation.
Thanks, Jack. All right. So it's great to hear from all of you that some of you have been to one and some haven't. So maybe you guys have been to someone called podiatrist. They're basically very similar, and now I'm going to talk about it. Okay, so who is a chiropodist? So in here, an Ontario chiropodist is a primary healthcare provider, which means we're able to help you without any referrals or second. We're not basically don't need referrals. We're described as a foot specialist who provides a variety of medical services ranging from something superficial such as nail and skin care to orthotics and even in-office surgeries as well. So basically anything pertaining to the foot and ankle, superficial to deep, any problems, you guys can find a chiropodist like me, and I'll address that questions for you guys and formulate the correct treatment plan. And so you guys know that chiropodist is actually an older term that is still used in Ontario here. In most other countries and even other provinces, they might have adopted the terms podiatrist, right, which I just mentioned, and that is actually more wide use terms. But unfortunately, it's not regulated here in Ontario, so I am called chiropodist. I can't be called podiatrist, but they're essentially very, very similar. They're both foot specialists. Okay, so what can a chiropodist do? Chiropodist can do a lot of treatments pertaining to the foot and ankle, as I said before. So here's a list for you guys. It's not exhaustive. It is the most common ones here that I did put down. So diabetic foot care, very common. Wound care, corn and calces. A lot of people have experienced that at least once in their lifetime. Orthotic therapy for different pathologies, warts, ingrown nails, fungal nails, athlete's foot. So basically, athlete's foot is another form of fungal infection as well of the skin. And then the heel, forefoot, arch pain, any pain in the ankle and the foot, we're able to help you out. So let's dive deeper into corn and calces, which is one of the most commonly experienced pathology. Or in other words, it might not be a pathologies if if it's benign. Some people, go to the gym and get that calluses like I do on the hand. Those are more physiological ones, but here we're talking about the pathological ones. So for corns and calluses, they basically thicken layer of skin due to constant irritation, constant pressure, rubbing, you know, stimulation to the skin, and that causes the skin to overgrowth and too rapidly, and that forms a thickened layer of skin. Your body is trying to protect itself, basically, but it's not always a good thing on the foot. So when corns and calces develop, they can be painful to walk on. They can even feel like pebbles underneath your foot. Although, some people might check and say, I feel like I'm constantly walking on a pebble, but I can never, find it. They think they're going nuts, but once they come to see me and they realize, oh, that was a corn in there. It was not a pebble, stuck somewhere in my foot, but I can't see. So that is a sign of a corn as well, feeling like a pebble. So why
Justin,
do
sorry,
you guys?
question here. There was a question in the chat. So corns and calluses, is that something that can be prevented with footwear, or does it come on with footwear? Somebody asked about is there like a genetic predisposition? My mom had them all the time. Is it because you're bound to get them, or is it occupational?
Oh, everything is correct here. There's a lot of different risk factor contributing
Okay.
to it. There's certain disease that make from genetics that causes cows to form more readily, but most of them are due to the way that you walk, taking more pressure at one point than the other foot types. Footwear definitely can cause calluses, especially tight footwears. A key pointer here, which I would also mention again later on, is that callus is usually on top of your foot or the side. They're usually more due to footwear itself. As when you walk, pressures that are rubbing against the foot on top and the side is usually from your shoes, right? So those can be prevented by having the right footwear for you guys. And I'll dive a little deeper later on about the footwear choices. Hopefully that's an interesting topic for you guys as well. So
Yeah,
yeah,
thanks
I
for
hope
that.
that addresses your question
Yeah, thank you very
there.
much.
No problem. So let's continue here with the calces as well. Again, why do we need to get our nails cut down and calces filed down regularly? So long nails, as most of you know, we do that on a regular basis. We cut them. It's because when they grow long, they're more easy to catch on. For the foot, it catches on socks. When you take them off, it can catch on the shoe. It can jam against something, and trauma can happen. And when that happens, it leads to a wound, a small wound. Even lacerations are a good opportunity for infections to harvest in your foot. So it is a good thing to routinely get them filed down and taken care of. Same thing with corns and calces. They themselves can be painful, as I mentioned before. So it is reason, to take care of them. Is pain is, very apparent reason to get that deal with. No one should be dealing with pain every single step, and that's a good start in taking care of those calluses. Um, Calluses can break down with excessive pressure. Sometimes the breakdown is not apparent. It could be within the calluses underneath it, deeper, and you might not notice. That can cause other problems such as scar tissue forming underneath, and with that breakdown, potential infections can get in, and that's not a good thing. So high risk patients, especially, uh, I do really recommend to get their nails and calluses filed down regularly and their nails cut because that diabetes, for example, an immunocompromised patient such as HIV, people with AIDS, something like people who are on blood thinner as well are classified as a high risk patient. This is because a common theme here is that a delay in healing, their status in healing is not as good. They're more prone to an infection because of that. And all sorts of reasons from there, at least to a great risk if proper foot care is not maintained. Okay, so let's jump into diabetes, which
Sorry,
is one of
sorry,
the,
Justin. One more question. I had somebody. Are calluses usually cut away using a scalpel blade by yourself? Is that something? What tools do you use to cut away calluses?
yes. Scalpel blade is a very we use different tools to depending on the need of the patient. But scalpel blade is one of the most common one. Is very effective and easy for us to manipulate and get rid of the calluses. No one else, just a key pointer here, should be using that. I don't recommend using that at home. A blade, don't take a blade to your foot. And even going to pedicure, if they take a blade to your foot, be alarmed. I don't. I'm not saying it unless there are chiropodists there working. They shouldn't be using a blade.
A good point.
It's very dangerous if they
Good
are
point.
not competent enough to use that. But yes, there are also other filing tools such as burrs and a Morse disk, like a sandpaper disk that we use with the rotary and tools that we file down calces as well. So yes, we do use scalpel blades, and it's one of the most often used tools here.
Great. Thank you.
Yeah, no problem. So continue with diabetes. A lot of patients, it is probably, if not the most highly suspected disease. I mean, one of the diabetes is one of the most prevalent disease here in Ontario. I believe either it is one of the top or next to heart attacks and heart disease as well. Um, it's very prevalent and it is a progressive disease, unfortunately. So managing it is one thing, is great, but usually it does progress depending on the level that you're treating it. It could be in a slow way, or it can be very very quick. So anyhow, with that being said, it does put the foot at a much higher risk because of several things here. Numbness, tingling, and burning sensation. These are key signs for diabetic sensory neuropathy. What that means is basically the nerves are damaged. You're basically not feeling or feeling burning sensation, feeling other sensation that is not atypical, or not feeling anything at all. And usually Corop is able to diagnose that with clinical diagnostic tests to see what are your risk level. Are you lacking sensation or at risk of that? So losing sensation is a huge thing that can make the feet really really vulnerable to trauma, and you do not know acknowledge it. So that can further lead to infections, ulcers, and then potentially even losing a limb or death. If it's not taken care of properly. Also, with diabetes, the blood flow is compromised as the nerves and also the blood vessels are damaged by the high sugar content. And that leads to decreased healing abilities and the slower reaction to fight infections by your immune system. So definitely, if you know someone or if you are patients with diabetes, it's recommended that you do get a checkup, not just with your doctor for the blood work, which is a good habit to do, which you should be doing, but also getting diabetic foot assessment to determine your risk level and the correct management plan to take care of that as well. So talking about the high-risk foot, what is considered a high-risk foot? So there are several key pointers here to classify that. Uh, First of all, the two main ones are neuropathy and ischemia. So note that they're not typical, they could be asymptomatic. So it's hard for patients sometimes to even diagnose them themselves, thinking, I don't think that's a problem, but it is very hard to tell. So that's why I did recommend to, get it checked out. So neuropathy, basically lack of sensation. Ischemia is the lack of blood flow or compromisation to the blood flow. And thinking of the foot, right, it is the most distal, the furthest away from your heart. So the first thing to get compromised by blood flow is usually starts in the toes, right? So losing sensation or the toes turning dark is key signs, and it's the first that you will notice usually in the body when you have diabetes, and those complications do can be seen there. Other risk factors include deformity, swelling, and calluses. So here in the next slides, just want to show you guys some images of what I was talking about. On the left top corner there, we see the toes turning blue and dark, and that's ischemia, basically a lack of blood flow. On the bottom of that, you see a huge callus, basically that adds onto the pressure, and with excessive pressure, it can break down, as I talked about. So that also creates another risk factor there. In the middle, we have swelling, that causes more irritation and greater opportunities for the skin to get compromised or get irritated by the shoe wear since it takes up space. Also, for the top right-hand corner, stepping on pins that's, without noticing the pain, that's neuropathy. And that's the danger of it, right? Having wounds underneath your feet, that is very dangerous when you do not notice. Your feet is always on the ground. Uh, Bacteria are very easily, and can enter through that. And the last picture there at the bottom right, you see what we call a bunion, basically the right toe deviated towards the second toe. And from that, you can see the second toe even overrides it. So with the bunions, it creates pressure points, right? You see on the redness on the ball joint there on the first toe. And you see a little corn on top of that second toe. And those are the pressure points, right? And those can be easily irritated or damaged or traumatized from footwear or other objects as well. Okay, so let's go into a topic of foot types. I know a lot of you are interested in that, knowing that, because everyone fall into three of these categories for sure. Either you have normal foot type, which is with medium arches, flat feet, with low arches, and high arch foot. Basically, a very hump foot, if some people refer that to a hump foot as another name for it. So arch types are generally influenced by genetics, although they are not a pathology itself. So we do not recommend, oh, your feet are too, flat or too high with surgeries. Just correct that foot shape. That's not recommended from the get-go. It is the complications that the flat feet or hard feet can lead to that is more alarming. So let's talk about those three types of feet here. Flat feet, also known as pes planus in the medical term. So you can see in these pictures here, the normal foot versus the flat foot, the fallen arch. You can see even on an imprint, if I were to put your foot in ink and step on the ground or a piece of paper, you will see the imprint that the C shape, the arch shape would be a little more filled in with ink, noticed here in the image as well. And that is a pointer that you have flat foot, but that's a really rough estimate you can do at home. But in clinic, this is not an accurate diagnosis of flat feet, but there are way more pointers and specifications to diagnosing the foot type here. So flat feet, some complications that it leads to. These are not exhaustive again. There's more to it, but the most common ones here are bunions. Believe it or not, a lot of people think that bunions are only genetics or only from wearing tight shoes or high heels, which put a lot of pressure to the forefoot. While these are true, but flat feet, a lot of people probably don't know about this. So now you can brag about it maybe that, it can lead to bunions. It is because of the biomechanical gait, the way that you walk, the pressure that is taken on the foot puts a lot of pressure on that first joint and leads it to jam and changes its course and it starts deviating to make your toe off in a gait a lot smoother. But that leads to that secondary pathology which is the bunions. And because of that bunions, we talked about in that picture again from the diabetic slides, that hammer toe can form because of that. Since the first toe, you notice that once it starts pushing over to the second, where does that second toe go? It can either have the option of going over it or under it, right? And either or creates the deformity. So hammer toe is when the first one goes under it, it pops it up, and you get a lot more pressure on top of that second toe. Next thing, plantar fasciitis, very common pathology here as well. And I can talk a lot more about that by itself. What that is basically inflammation of the plantar fascia, the fascia, the sheath of, it's the sheath that holds your arch basically in a more layman's term, and that can get irritated. So you would feel usually arch and heel pain, and key note to having plantar fasciitis is the first step in the morning when you step off the bed, or after you rest up. It's very, very, very painful. More painful than usually. After it warms up, it gets a little better, and then it could worsen again. And also, calces and corns can form from flat feet because you take more pressure underneath the second to fourth ball joints on the bottom of your foot. The jamming happens at the ball joint of the first toe, which if it does not lead to bunion, it can lead to just pure jamming, which leads to joint being arthritic. And you notice that your first toe starts to become more stiff, and the range of motion can take a toll as well, and that affects your gait. Also, arch pain, soreness, and tiredness are associated with this as well. You might even look down and notice that your fifth toe is a little rotated in, curled up, and turned to the side, like it's trying to grip the ground. That's a sign of digiti minimi quinti varus, basically a fancy term saying that your fifth toe is rotated, because when you have flat feet, you have overpronation, which means your arch is collapsed. So once you lose a little bit of stability on the outside, it starts to grab the ground for stability, and that is subconscious. So over time, that deformity can develop, and if you notice that, that could be a pointer that, hey, maybe I do have more flatter, foot shape. High arch foot. So opposite to a flat feet, here we have the high arch. And there are its own sets of complications that is associated with them. Again, not exhaustive, but I'll just let you know the most common ones. Heel and ball pain and calces forming at the same spot. What we call from these calces, we usually see them on the first and the fifth of the ball joint on the bottom, and the heel as well. And this is because of what we call a tripod stance. So notice that in a high arch foot, your arch is higher. So the only contact between the ground and your foot is the ball of your foot and the heel. The middle part is usually already, off the ground. So you're basically taking more pressure at those points, which calces can form. So first, fifth, and the heel. And when you put that on an imprint, it looks like a tripod stance, hence the name. Also, from that lack of absorption because of that tripod stance, your foot's typically a little more stiff, and that leads to lack of shock absorption during the heel strike of a gait cycle. What that means is basically the first thing when you hit the ground, you usually contact the ground with your heel, and that is where your foot should flatten out a little bit and takes the shock in the foot itself. But because of the high arch, you're not able to flatten your arch as much. You take a lot of the pain and transferring that shock wave, we call that more energy up the chain towards the knee and back, and that can cause knee pain and back problem. So your whole body is a kinetic chain, right? So it's all connected. So once you hit the ground, the shock and the pressure goes up, and depending on where it takes a lot of energy more than the other, it can cause problems. And that's where the physiotherapy at our clinics as well comes in play here and can help you guys as well. Okay, so retract the digits. So you might see that your toes might be flying up a little bit or curled back because usually with a higher foot, you're a little tight on the top as well. And that can lead to the retraction of the digits forming, just like the hammer toe, pressure points, right, on top once it's curled up. So bursitis, basically inflammation of the fluid sacs that protects your joint, can become inflamed. And also corns can form on top of those knuckles as well, on top of the joints. Again, plantar fasciitis is also associated with the arch foot as well in a different way, which can also lead to the arch and heel pain. Tightness of midfoot in shoes because of that hump. You tend to notice that when you put it in the shoe, sometimes you might feel like there's not enough depth in that shoe to hold your foot, and some patients might even have to loosen their laces or skip one row of eyelet to tie their shoes to get that relief of that pressure on the midfoot. So for the importance of footwear, picking the right shoes for your feet is very important. And a lot of you guys are probably very interested, as I got a question earlier from you guys. So here it is. So some general pointers, some features to avoid in general regarding this. Doesn't matter what foot type you have. These are good general features to have when you're selecting footwear in general. So you should avoid tight, narrow, and shallow toe box. That leads to the compression of the forefoot. So what I mean is if you do take off your shoes and you notice red marks, basically pressure points on your foot, means that your toe box, the front area of a shoe, is a little too tight. And that can lead to corns and calces, again, on the sides and top of your foot. And that's, remember what I said with the pointers that, hey, it might be a shoe problem, right, when it's on top and on the side. And they can be dealt with by, selecting something with a wider toe box. So here's a little tip for you guys. When you go buy shoes, certain brands do offer wide or extra wide in the toe box, and you can just ask for that in the store. So the terms for that, sometimes they list it on the box, might be a D for women, which stands for wide. 2E stands for extra wide, something like that. But if you go into the store and you mention wide or extra wide, usually the people there will be able to help you address that and find the shoes for you. So second, you would want to avoid a flimsy heel counter. What I mean is, let me grab a shoe here and show you. It's a little better if you guys can see me. Let's see. Again, I have quite a few shoes, so I'm just gonna grab one here. So heel counter is basically the back of the heel of a shoe, immediately above the outsole. So you notice that right above it, you should give it a little squeeze, and that should be firm. It should take a lot of pressure to even crush it. So if that heel counter can just compress with light pressure, it's probably not holding your ankle properly, and that could lead to ankle instability, and it's more prone to ankle sprains. Also, firmer heel counter is good for plantar fasciitis or people even with flatter feet, because that helps with the control of the excessive movement of the subtalar joint, which is the joint for responsible for flattening or controlling the arches. So with the firmer heel counter, it can hold your foot in place a little better, and it can help with the prevention of the secondary pathologies that I mentioned there on the previous slides. Also, the last point, the torsional rigidity. So when you grab a shoe and you try to wring it out like a towel, it shouldn't do that. If your shoe can just wring it out like a towel easily, it's probably offering you a poor arch support there. Also, for indoor, I strongly recommend that indoor shoes are worn at best. If not, slippers can do. They're better than bare feet. So remember, shoes do offer cushioning, and it gives you a better shock absorption in general. Also, it prevents and mitigates any trauma to the foot, such as stubbing your foot, your toe against the desk, and that could cushion that impact, right? So you're less likely to get injured. Also prevents the spread of, I don't know, bacteria, viruses, and fungus. Um, who knows what your family members or guests might have when they come into your house, right? So it is a good thing to, wear some shoes to prevent the spread of that as well. Also, as this is very important for diabetic patients and immunocompromised patients as well, um, because having a weaker immune system to heal from infection, there should be more precautions taken. And one of the greatest things to do is have shoes worn indoor. Not don't go barefoot. Do yourself a favor, because once you know any trauma that gets unnoticed and penetrated, it can cause a lot of trouble for you. So wear indoor shoes with a decent amount of cushioning underneath, and also to protect your feet. So a little more specific here for the foot types and shoe selection. So again, right, firm heel counter, good torsional rigidity is given. But for flat feet, also look for straight last shoes. I'll show you the image for what I mean when we talk about the last of a shoe. Okay, on the next slide. High arch feet. So you want to look for something again, firm heel counter, but also look inside the shoe, feel the cushioning system. It should offer you a little better cushioning for the shock absorption that you guys might lack. And also you want to look for semi-curved to curved last shoes. So do note that based on these selections, they're not specifically say, hey, you have high arch foot and here you should definitely get something like this, only like this. So seeing chiropodists sometimes with the problems that you have or other deformities or specifications that you might need, it is usually recommended, such as, just give you one example here, some people with that jamming again of the first toe or, bunions, having a rocker bottom might be able to help them, with the motion easier when they walk to get over that jamming. So that's extra specifications that might be needed, tailored to you by your chiropodist, or you can come visit me and I can kind of give you some pointers to what shoes you might want to have. So here's an image for the last we were talking about in the last slide. As you can see, the pink outsole there is a straight last. So the bottom of the shoe is pretty straight, you see. That for a flat feet, having that greater surface area coverage by the straight last is good, is better support for your feet. And for the semi-curved and curved last is not recommended for flat feet. However, for high arch foot, go ahead, since your arches probably won't even touch the ground there. And more importantly, just choose the curve that has cushioning inside, and semi-curved to curved will be suitable for you regardless.
All right.
Oh, before we jump into that, I believe we have a poll.
Yeah, just a question. I know we're almost done with the presentation, Justin. I've learned a lot myself. Thank you so much. I'm sure our participants have a question, and we are at the end here, so I'm going to try not to disrupt too much more of the presentation. So we're right towards the end. There's a question about differentiating between a heel spur and plantar fasciitis. Are those synonymous? Are those conditions that are separate from each other? Can they concur with each other? If you can verify that, or at least lend to that, please.
Sure. That's a great question. So a lot of people might come and say, "Oh, I have a heel spur," and they might think that is the reason causing the pain there. Heel spur is actually a reaction to pathology. So basically, your heel bone usually does not have a spur, right? So when the spur occurs, is basically that the fascia could be one of the reason. The plantar fascia is too tight or it's pulling on it, and over time, that leads to the bone remodeling, right? It breaks down and then it forms again, trying to adjust itself to lengthen to that stretch. And that's why you get a bone spur. But that could also happen with other pathologies that attach to the heel as well, such as the Achilles. You get bone spur at the back of the heel, which other muscles that attach on the calcaneus can cause that as well, but to a way less extent. The most common one is the plantar fascia, and that's why a lot of people associate plantar fascia with heel spur, synonymous the same thing. But the key issue here is that if you do have a heel spur, it is very, very likely that you have other pathology that leads up to that. So whether it's plantar fasciitis, Achilles tendonitis, you should definitely get that checked out because that's probably what causing you the pain after all, and they can be dealt with.
That's great. Thank you very much. I do have a couple more questions, but what we'll do is we're going to run before the right at the end. There's a couple of FAQs Justin wants to ask. We're just going to run our next poll. Real quick one, just to see if everyone was paying attention, which I'm sure you were. It was really intriguing. So I'm going to go ahead and launch this poll here about what are chiropodists actually allowed to do. I didn't know the whole litany of things that chiropodists were allowed to do. But talking to Justin, there's been quite a few people, quite a few things that. Okay, here we go. It wasn't so much of a trick question here. So yeah, Justin, it's been a fantastic presentation. There's a few more minutes to go here, so hold on, everyone. We have actually this is one of our first presentations that we haven't had a whole bunch of people leaving. We have a couple more questions to go, so I'll close the polls in a couple of minutes. That's great. So yeah. Chiropodists are allowed to do all of the above. They, as Justin mentioned, they perform surgeries. They can inject joints of the foot. I'll let Justin talk about that a little bit. And prescription medication for a few things that Justin was talking about: fungal infections, paronychias, those things that Justin treats all the time. I'll close the poll here. Thanks again, everyone. There's a question from Giovanni Mazzacco. I'm going to answer that or get Justin to answer that in a second. I'll just let him finish off his slide and then we'll open up the Q&A.
All right, thank you, Jack. All right, so we went over that question. It's also right here. It's one of the more frequently asked questions. On this slide, I'll also provide the website here to more of those frequently asked questions of what chiropodists do and the typical questions asked of what they can do, how can I see one and stuff like that. But here's a few that are top 3 that are most commonly asked. So 1, do I need a doctor's referral? So as I mentioned before in the description of what a chiropodist is, it says that is a primary healthcare practitioner. And so not just a chiropodist, so any primary healthcare providers are able to treat you without referrals. So the answer is no. You can just make an appointment with me or other chiropodists, and they will be able to help you with your visit there. You don't need a prescription or anything to see us or to get your orthotics or anything like that. We're basically your first stop and for foot care. And also second one, basically a lot of patients ask, are we covered by Ohip? Unfortunately, no, we're not covered by Ohip. However, a lot of extended health insurance covers us, just like dentist and optometrist like that. So every health plan is different. So do give yours a little check and see, prior to your visit is a good idea to see if, as much as we want to stay away from the finances, but it is a, issue for people. It is for me too, right? So everyone do care about their finances. So if you have the benefits and you're hesitant to see a chiropodist because of the cost, and maybe that would be able to help you out a lot. So do contact your insurance plan and learn about those specifics. And the last one we just answered: can we prescribe medication and perform injection? Yes, and a lot of you guys answered that correctly. So just to elaborate that a little more, we can, depending on your conditions, we can prescribe medications, oral, topical, for antibiotics, antifungals, painkillers, corticosteroids, and much more, depending on the conditions. And we're also competent enough to perform injections for various needs, such as most common ones would be lidocaine, which is a local anesthetics, before we do surgeries like a nail surgery for ingrown, wart surgery, something like that. So if we can get inside the tissues for surgery, yes, we can also do injections. And yeah, so we basically went through that. If you guys have any more questions, feel free to, type in chat below, and me and Jack will try to get to you as soon as possible. But if we don't get to your questions, again, you guys can type in phone in the chat if you guys want, in a hurry to leave, or you want your questions to be addressed um, personally, that you're not, you want to get a brief phone call consultation with me to see if I can answer your question. You can do that as well. We'll send out an email to contact you and try to set one up with you. So that will be great as well.
So Justin, I got a couple questions, and we're not running out of time, but some people are typing into the chat. Thank you very much. We'll make sure that we record that. A question from Giovanni. He was asking about tips that you could provide for foot care at the end of a shift. Sounds like Giovanni maybe stands a lot on his feet. Is there anything like a prophylaxis type foot care, like Epsom salts or anything like that you would recommend?
Sure. You mind repeating the first part of the question again?
Yeah, so Giovanni was asking about tips that you could provide the attendees with, um, um, that you could do for foot care at the end of a shift, a work shift.
So after work shifts, I mean probably tired feet, or it's just general care, right, for your foot. Um, for that reason, for sure, rest it. If you stand, long hours, it's not recommended that even sitting, right, same thing, in certain position for long hours. So if your job does require you to stand and walk for a long while, take that opportunity to rest your feet. Okay. Uh, Second, good care would be checking your feet, right? Notice any swelling, any redness. That could be signs that it's heating up or taking a lot of pressure. Do rest it, or might need to be iced accordingly. Epsom foot salt, as you mentioned, is a good relief, or soothing soaks for your feet. Just make sure to dry your feet completely before leaving or putting your socks on, because that can trap moisture between your digits, and that could lead to macerations, basically skin breakdown between your digits. Other pointers could be just simple, exercising, stretching of your foot. The calf muscles, can stretch your foot in different directions, not excessively, just feel the stretch. Nothing should be painful. Also, even casually rolling your arch, or if you notice swelling in your feet, because of standing all day, the blood pools down. You can sit and elevate your limb, or lie down and elevate your limb above your heart. That would help with, soothe out some of the swelling down in the feet as well, because gravity does pull your blood down, and if you're constantly standing or sitting, that could be an issue. So hope that helps.
Okay, we have another question is from an anonymous attendee. She's talking about having fibromyalgia and
Mhm.
waking up in the morning feeling like her feet are curled up in knots. Do you feel that? And I know this is probably difficult with not having a long history. The bottoms of the feet feel that they're like curled up in knots. Is that something you think maybe nerve related, related to the fibromyalgia, or it could be something else?
It is potentially related, but that's very hard to answer without knowing the exact history again.
Hmm. Hmm.
But there could be other underlying mechanisms, such as lack of vitamins, other systemic concerns. If both feet curls up, it's more systemic, and that could be done via blood work to see if you're missing any key substance in your blood, or any nutrients that you should be taking. Or it could be other pathologies that could be affecting it as well, tightness, and the foot and the muscles, because fibromyalgia is technically affects the whole body. It's a systemic disease, and it's very hard to treat.
Hmm.
It can affect your sleep as well, and because of that, some of the hormones could be altered, and there's a bunch of things I can talk about here that could be causing that. But to
Understood.
specify the reason for yours,
Hmm.
it's hard to say at this point. But yes, it could be related, or it could be secondarily related, not directly because of fibromyalgia, but because of certain things down the chain. That could be one of the issues there.
Okay, and we got one more question before we do a giveaway. I see some of the attendees are leaving. I have done a randomized giveaway. One is a consult with Justin, an in-person consult, and then the other one is a foam roller, a physio ball, and some TheraBand. So, Justin, I'll just let somebody. There's somebody's asking about getting cold feet even when wearing socks when they go to bed. And it's not a daytime problem, and eventually goes away as this person sleeps. Any suggestions for that?
Okay, so what we call that is a Reynolds phenomenon in a fancy term. Basically, your sympathetic nervous system is usually hyperactive, and sometimes you get numbness or even cold feet, even at night or especially during winter time. For some suggestions I would give is even with soaks, the warm soaks before bed, Epsom salt and warm water can help relieve some of that. Uh, However, it will go away on its own. It is just the phenomenon that is associated with the nervous system, which sometimes is harder to treat. So avoiding the cold, whether before you sleep would be nice. So staying inside before you jump right into bed can help, or keeping yourself warm even just before bedtime. Your foot, wearing socks throughout, the hour or two before you head to bed. That could possibly help. But again, depending on the situation, if it's the nerve problem or other stuff that is causing that, that could be a little different. But you can try that first without me seeing you personally. That's as much as I can give you in more of a general term stuff that you can try.
Great. Um, if there are any other questions, please feel free to type it in the chat. We're going to try to wrap it up. I just want to say to everyone, thank you very much, so much for attending our very first cooperative webinar. I think it was a huge success. I just want to remind everybody that the webinar will be posted on our websites: Bradford Sports Medicine Professionals, Aurora Sports Medicine Professionals, and Nobleton Physiotherapy. So if you give us a few days to get that posted. And then you could always talk to a family friend or member of the family to let them know that this is something that you found useful if they want to watch it on a recorded session. So I have done a randomization here. So I want to congratulate Nuno Alexander for the foam roller, physio ball, and TheraBand, and Lynn Johns for a one-on-one free session in clinic, whichever clinic suits you most. So thank you, Lynn Johns, for the one-on-one session, and Nuno Alexander. We will be contacting you to pick up your small little prizes. And again, I just really want to thank Justin for doing this. Justin has joined us after Tracy retired, and he has had some really great feedback from his patients and from the clinicians that are working with him. It's such a nice team member to have. I don't specialize in feet. I'm more of a lower extremity, knees and up kind of guy. But when I run into some issues, I definitely will refer to Justin and have referred. So once again, thank you so much, everybody, for participating tonight. There are some I feel like we've answered most of the questions. And if there are any other questions needing to be answered, please type it in the chat. We will contact those of you who have posted a phone conversation with Justin. He'll try to get back to you at a timely manner. Again, thank you so much. Nuno and Lynn, please give us a couple days. We'll get in contact to you to pick up your stuff. And Justin, any closing remarks or anything else?
That's pretty much it. Thank you for everyone for tuning in, listening to my first webinar actually. Before that, I gotta be honest, a little nerve-wracking speaking in front of a computer. I like to engage a lot of people in person, but COVID does make it a little harder to host those sessions. And it is an easy way to talk to you guys through here and sharing screens and everything. But thanks for bearing with me if I missed something that you guys might want to know. But I'll be here in the clinics, so feel free to give me a call at one of these clinics. you will be able to find me. Just speak to one of the staffs. Say, I want to look for Justin, or if any of your family members or friends need help too, I'll be there. So hopefully, rather sooner or later, I can get your questions addressed, and I'll be glad if I can be able to help you out.
All right, well, that does it for tonight. Thank you to all our attendees, Justin, for providing your time tonight, and I will sign off. And please give us a call if you have any questions. Nobleton Physiotherapy, Bradford Sports Medicine Professionals, Aurora Sports Medicine Professionals. Thank you very much, and have a good night.
Thanks. Good night.